Following everything that is happening currently in the UK space, and also in the last couple of years, it has become much more difficult for IMG professionals to be able to get jobs here in the UK. A lot of doctors who are coming in mainly through the specialty training programs. Compared to what it used to be in the past, there isn't a lot of job availability or vacancies for IMG professionals. And unfortunately, a lot of IMG doctors are currently in limbo about their future as doctors here in the UK, because they have sat for the exams, the plab exams, they have become GMC licensed, and you expect that after being GMC licensed, you should have opportunities to seek for jobs and be able to work as doctors with, your license. But unfortunately, a lot of these doctors, thousands of doctors, yes, they are actually in their thousands, who are GMC licensed and are unable to get jobs as doctors here in the UK. Not just doctors, even nurses are struggling to get jobs here in the UK. Now, the question remains, is this just something that is happening? Is this just something that is just happening in this current space? Or is there a chance that this could persist or even worsen in the future? I mean, will the UK still continue to hire IMG professionals in the coming years? I'm just going to be sharing my thoughts based on the available information at this time, and feel free to share your opinion in the comment section. And so let's just get right to it. Hello, my name is Blessing and I'm a doctor practicing in the UK, and if today is your first time here, I want to say you're welcome. And if you are a subscriber, I want to say thank you for your support so far. So I actually think that there are two sides to it. Everything right now seems to be pointing in a certain direction, which is that things are probably going to get worse in the future. I mean, in terms of job opportunities for IMG professionals. And that is due to a lot of reasons. The NHS workforce plan, which the target is that by 2035, the number or the percentage of IMG professionals in the NHS should have reduced from the current figure of 25% to about 9 to 10.5%. That is more than 50% drop. So it means that this is not just that we'll get unemployment that should be in the NHS. So it means that a lot of effort is going into the entire process, and we can see that these plans are already kickstarting. Now, there are also some other professionals who are being trained domestically to be able to do some jobs that definitely reduces the need for more doctors within the healthcare team. For example, the physician associates, the ACPs, the anesthetics associates. All of these professionals are domestically trained, and they are able to take up a lot of roles that traditionally or historically doctors are usually saddled with those responsibilities. And that is why gradually it's looking like there is a reducing need for certain cadres of doctors. And as it is right now, there are reports that the number of physician associates and anesthetics associates that will be licensed yearly is going to continue to increase. So as this group of healthcare professionals keep increasing in the system, just imagine what is going to happen. It means that there will continue to be a further reduction in the need for certain cadres of doctors. So which is usually like the very junior doctors, and a lot of IMG doctors fall into these categories, because when IMG doctors come into the NHS, most people usually start with the junior roles and then gradually go up the ladder. But if these junior roles are no longer available to these IMG professionals, then it means that their chance of being able to work in the NHS is going to continue to reduce gradually until there is almost no room for them. There are also a lot of other groundworks as outlined in both the NHS workforce plan and even for the 10 years plan for England, the expansion of medical undergraduate medical training that is already in place. It's been reported that many more doctors are graduating every year. It's in 2025, it's reported that over 13,000 doctors should graduate, and this number is anticipated to increase even in the coming years. So if more doctors are being produced locally, it means that there would definitely continue to be a reduced need to bring in IMG professionals, IMG nurses, or IMG doctors. In the recent 10 years plan for England, there is a plan to increase specialty training posts and also to prioritize UK medical graduates. Now, when this happened, the implication is that it is only doctors who are trained in the UK that will be able to get into the specialty training programs. And recently, since a lot of IMG doctors are not able to get in through the non-training pathways, because there are obviously no vacancies for these IMG doctors to come in and fill, a lot of IMG doctors have now opted to come in through the specialty pathway, which is also very competitive. But a few persons are still able to get into the system through this training pathway. Now, when the prioritization sets in, or is commenced, it means that this pathway is going to be short for IMG doctors outside of the UK, most especially, and even for some IMG doctors within the UK already. So it means that gradually it's beginning to look like there will continue to be a further decrease in the need or the opportunities available for IMG doctors within the NHS, or IMG professionals within the NHS system. So now, having said all of this, now the other side to it is, because a few persons are still hoping and they are thinking, okay, maybe this is just something that is happening just in the current phase, and it's probably going to improve in the coming years. And I guess one of the things that could support that is the fact that recently there have been reports of a lot of UK medical graduates seeking for opportunities, better paying opportunities outside of the UK. So you hear of doctors going to the Gulf countries, migrating to various other countries to seek for better paying jobs and better working opportunities. And if this continues to happen, it means that the number of UK medical graduates that will be needed to fill in this position might reduce, and maybe there might be need to fill in some of this position, especially after the medical after the specialty training program has been expanded and there are more positions to fill. Then it means that if there are not enough medical graduates to fill this post, then it means that there might still be opportunities for IMG doctors who are GMC licensed to be able to come in. But truly, that is not guaranteed, because we don't have the actual figures. We don't know how many spaces are going to be expanded. We don't know if the expansion is going to happen gradually. We don't know how much. We don't know if, as the number of undergraduate medical doctors keep increasing, it might just be enough to fill up all the spaces that will be available even after the expansion. So that is still also not guaranteed. Also, there are some professionals who are leaving the system, maybe people who are getting retired, or maybe professionals who are moving to some other countries to seek for better opportunities or better life, or for even personal reasons. These spaces will have to be covered, and there will be need for doctors, healthcare professionals to fill up all of these spaces. So maybe that might provide some opportunity for IMG professionals to still be able to get into the system if this trend of professionals leaving the UK continues to be on the rise, because recently there have been reports of a lot of professionals leaving the system because of all the things happening in the country, especially the whole anti-immigration discussion going on the media, and you know, everything. A lot of people are beginning to feel like, especially for the IMG professionals, they are beginning to feel like maybe there is really no future for an IMG professional here in the UK, and people are beginning, and these professionals are beginning to consider some other countries that can offer them the atmosphere or the environment or the future that they desire. Now, if this continues to be a trend and many more leave the system, there might be room for some others to be able to come in. But just like I said, this is not guaranteed. So why exactly are we having this discussion? As an IMG, UK probably in a few years ago used to be like one of those countries that you look forward to, or where you think that there are opportunities for IMG doctors. However, with the current situation, with the current pictures, with everything that is going on in the country, the policies being rolled out in recent time, it's beginning to look more and more like the country is intentionally trying to do away with a lot of IMG professionals in the system. So what does this mean? If peradventure you're an IMG doctor and you are already GMC licensed and you're looking for an opportunity, yes, continue to find or seek for opportunities. Yes, I'm not saying it is completely out of the way. Some persons are still able to get a few non-training jobs. Yes, so please keep applying for jobs. If there are any available vacancies, keep trying for those jobs. It is still possible in the meantime to still get in through the non-training pathways. Still continue to make preparations for the exams, maybe to come in to increase your chance of being able to come in through the specialty training pathway before the prioritization is commenced. And the other one is maybe it is time to consider some other countries that you can explore with your plab results. I think there are some other countries that you may be able to explore with your plab results. And even in the worst case scenario, maybe start considering opportunities within your own country, because it wouldn't make sense for you to pause your life hoping for an opportunity here in the UK, and then years keep passing you by and these opportunities not coming. And I'm saying this because we are not sure what is going to happen in the future. Yes, policies can change a whole lot of things, but even with everything that is happening in the country right now, UK doesn't seem like a promising country for IMGs in the near future. And that is because of all of the changes that are being made to make immigration quite unattractive. So I'm just saying that consider all of this while you make your decision and you are going through every phase of your journey as an IMG doctor. So this is where I'm going to be ending this video today. Feel free to share your thoughts, feel free to share your opinions in the comment section. I look forward to hearing from you about it. Until I see you again, take care. Bye.